on TV. What time do you normally start?
All right, so welcome to the program, ladies and gentlemen. This is Ask Your Pediatrician, and of course today we begin a journey of discussing many common problems that children tend to suffer from. So in the next couple of weeks, let's say in the next 4 weeks, we're going to be discussing common problems, common diseases that usually affect the children. And in line of these, our first one is urinary tract infection. Urinary tract infection. And of course, I have Dr. Mwaba, who is a pediatrician as well, from the University of Zambia, who's going to help us understand what urinary tract infection is, and of course just how it affects children, how do children get to get it, and so on and so forth. For your participation, obviously the number is on your screens. You can actually get in touch with us via text messages only. You can send us text messages on that particular line, and of course for any question, Dr. Mwaba is here just to get to them. Dr. Mwaba, welcome to the discussion, and of course good to see you.
Thank you, Nelson. I'm excited to be here.
We are very excited to have you as well. The first things first, right. What is a urinary tract infection?
Okay, Nelson. I was actually going to start by saying that I was very excited when you told me the topic for discussion today. And that's because urinary tract infections are probably like the second most common infections that pediatricians or people looking after children will come across. And so, therefore, it's quite common in children. And then beyond that, we also have to keep in mind that they're an important infection to consider in children because of the long-term effects of poorly treated urinary tract infections in children. Firstly, we worry that if urinary tract infections are not properly tackled, and particularly if they're recurrent, these children will be more predisposed to hypertension when they become adults. These children, particularly the girls, are more predisposed to getting pregnancy-related complications, and some of these children may actually end up with renal failure. So it's a very important topic for us to tackle from the long-term perspective. But in the short term, urinary tract infections cause worry for parents because of the discomfort for the children, but also they're a risk to the children's life. Because if a child gets a severe urinary tract infection, that can translate into septicemia, and that can cause death. So they need to be recognized and appropriately treated. So coming back to your interesting question of what urinary tract infections are, I think it would be interesting firstly to look at the background. Like when we say urinary tract, what do we mean? Urinary tract in a human being would include that space in the body, all the way from the kidneys, including the ureters, that's the tubes that move urine from the kidneys into the bladder itself, and the tube known as the urethra, which transports urine from the bladder to the outside world. Typically, that space is sterile. We're not supposed to have any bacteria there. So when we get invasion and multiplication of bacteria in that normally sterile space, that is what is referred to as a urinary tract infection.
Interesting. When we're talking about children or infants here, which age group seem to be more at risk of developing these types of infections?
Okay, interesting question. Actually, all children can get urinary tract infections, but urinary tract infections are more common in girls, and that's just basically because of the anatomy. So the proximity of that opening of the tube that connects the bladder to the outside world, the urethra, to the bowel. So it's shorter in girls, and so because of that, it predisposes them to getting infections. But beyond girls being more at risk, you also have infants, children who are less than 1 year, being at higher risk. In fact, some of the statistics that we get from the West are that by the time girls reach the age of 7 years, about 8% of them will have had a urinary tract infection, as compared to, I think, 1% to 3% for boys. And that prevalence is much higher for children who are less than 1 year.
So what causes, these infections in little children? Maybe for an adult,
Mm-hmm.
it could we could easily relate it to, you know, hygiene, toilet, you know, behavior and all that.
Mm-hmm.
But for little children,
Mm-hmm.
what really causes these urinary tract infections?
Okay, that's a good question. I think to answer it appropriately, we would need to go back to what is normal.
Mm-hmm.
So we've talked about what the urinary tract is. So ordinarily, when urine is made in the kidneys, it flows in one direction, right, to the outside world.
Mm-hmm.
So there are some children that may have abnormalities where they get reverse flow of urine from the bladder back up into the kidneys. They may have abnormalities of the bladder, of the kidney that they were born with, of the urinary tract, that predisposes them to urinary tract infections. And then for other children, it may also have to do with behaviors, such as, for example, for girls, if you give your little girl a bubble bath, because the soap disturbs the normal chemical constituents of the urinary tract,
Mm-hmm.
the outside, the perineum, that may also predispose the child to urinary tract infections. And then, as you mentioned, poor hygiene. So particularly for girls, because of that short urethra, if they wipe from back to front, they'll be pushing bacteria that are normally associated with bowel closer to the opening of the urethra, and that would predispose them to urinary tract infections. Other things are, genetics. There are just some people who, because of the way the genes of those people were created, the defense of the urinary tract is affected. So those are some of the things that may predispose children to urinary tract infections. And then finally, we have a group of children who, for example, have conditions like diabetes, children that may have abnormalities of the spine, that those conditions affect the normal emptying of the bladder. Those are some of the things that would predispose children. And then very, very rarely, sexual abuse, for example, in smaller children, because sexual activity would bring the bacteria that are normally found in the vagina, in the bowel, into closer proximity with the urethra. That would also predispose kids to urinary tract infections. And also in adolescents who are sexually active, they would then be more predisposed to urinary tract infections.
Just in your between your preamble and now, you've frequently referred to bacteria. What kind of bacteria are we talking about here? Are we talking about normal floras, or we're talking about bacteria that are not needed in the body, for example?
Okay, so remember I said that in 90% of the cases of urinary tract infection, the bacteria that will cause the infection is coming from the bowel,
Mm-hmm.
because of the proximity of all of those, both of them, bowel and the urethra. Those are tubes next to each other. And it's inevitable that there'll be some form of contamination, which would then lead to the normal bacteria going up the urethra into the bladder to cause that initial infection. But there are certain types of bacteria that, have special features that allow them to cling to the lining of the bladder that other ordinary bacteria might not have. But typically, in about 90% of the cases, we have a bacteria known as E. coli
Mm-hmm.
causing infection. Other than that, there's another bacteria known as Klebsiella. And all these bacteria are normally found in the bowel.
Okay, interesting. What are some of the symptoms that would indicate to a mother, to a nursing mother, to a parent, either male, female, that possibly their child has this kind of an infection?
Okay, that's an important question. So in terms of how a child who has urinary tract infection would present, it sort of depends on whether which part of the urinary tract is infected. So if you have involvement of the kidneys, that's known as an upper urinary tract infection. Whereas if you have infection of the bladder, lower down, that's known as a lower urinary tract infection. So kids that have your lower urinary tract infection, particularly older children, will complain about burning sensation when they try and pass urine. They'll have pain on passing urine. They will have frequency. So every few minutes, child will want to pass urine, and they'll be passing probably small amounts of urine, and they'll be uncomfortable like that. If the kidneys, or if one has an upper urinary tract infection, those children are sick. They'll often have fever of greater than 38 degrees Celsius. Okay. They may be vomiting, they may have abdominal pain, they'll have pain in the flanks. But that is for older children. So the dilemma is in the age group less than 2 years, because those are pre-verbal children, so they can't really verbalize what they're feeling. So I think then the onus is on us as healthcare workers as we come into contact with children who are less than 2 years, who may have fever, which we can't explain by they have a runny nose or they have pneumonia, so unspecific kind of fever. Children like that would have to then be investigated for a urinary tract infection.
What are some of the predisposing features that might actually put or predispose a child to these infections?
Okay, so you remember when you asked me about some of the causes of urinary tract infection, I had mentioned earlier that there are certain conditions that make it more likely that a child will get a urinary tract infection. Being a girl, being less than 1 year, those are risk factors, and then having abnormalities of the urinary tract, which prevent the normal flow of urine, constipation in children, because it just makes more bacteria available to invade the urinary tract, being immunosuppressed. For example, when we have diabetic kids who are poorly controlled, that sort of makes them immunocompromised and makes it more likely that they'll get a urinary tract infection.
All right, so ladies and gentlemen, you are still watching Ask Your Pediatrician, and of course we are discussing urinary tract infection. Dr. Mawa is in the studio to help us understand broadly what these infections are, and of course how they affect the health of your child. As well, for your questions, the number on your screen is the one that you can use to send us your text message, and we should be able to get to that. Are there any physical, any change, any physical appearance that might indicate that this child perhaps might have urinary tract infection? For example, discharge, for example, passing urine with a certain color, or anything change in urine color or something like that?
Well, not really a discharge, but certainly there may be changes to the smell of the urine. It may become strong smelling, foul smelling urine. That may be an indicator. Patient may also complain about discomfort in the lower abdomen area, the suprapubic area. So basically, those would be the physical findings. If we're looking at certain children that have conditions that predispose them to urinary tract infections, some boys may have obstruction to the outflow of the bladder. So in that kind of a situation, you may be able to feel the bladder in the lower part of the abdomen because of poor emptying of the bladder. But by and large, it's basically from the history. The child being uncomfortable with passing urine, the burning sensation, or in upper urinary tract infections, very sick child vomiting with high fevers and maybe flank pain.
Okay. How is the diagnosis done?
Okay, that's a very, very important question. So by definition, we have to prove that there's bacteria in the urine. So, but for that test to be valid, the method of collection of the urine has to be correct. So often you get people referred to you with the referring person saying that the child has urinary tract infection, when the way the urine was collected was by placing a bag next to the urethra, an adhesive bag and then collecting urine, and often the urine will be contaminated by fecal matter, and so obviously that would not be a reliable sample. So healthcare workers then would have to make sure that they use the correct method, which would be either an in and out catheter for children who are not toilet trained, or in older children to ask them to give us what is known as a midstream urine, where you ask the child to pass urine, so the initial urine comes out, and then you get what is in the middle of the stream. So not at the beginning, not at the end, so that you reduce the chances of contamination. So once you get that appropriate sample of urine, the gold standard for making a diagnosis is to send that urine to the lab and do what is known as a culture of the urine. So we have different criteria based on how the urine was collected to make a diagnosis of urinary tract infection. We have what are known as screening tests, which can be done basically anywhere, and that would involve doing what is known as a dipstick, urine dipstick. And if a patient has leukocytes or white cells, or if they have a substance known as nitrites in the urine, that is suggestive of a urinary tract infection. But for me to be able to say definitively that a child, does not have a urinary tract infection, I would need to do a culture of the urine.
When a mother possibly notices some of the symptoms that you highlighted earlier in her child, or when a father definitely does that, what should be the reaction? How should they look at it? How should they take it?
Well, the reaction would be that I would hope that the parents would take the child to the nearest health center, so that the health workers then would do the appropriate tests and make sure that it is a urinary tract infection, or if it isn't, they try and figure out what other things may be going on with the child and recommend appropriate treatment.
Okay, so you heard it for yourself. So if you're a father, or if you're a mother, or maybe if you're a guardian of little kids in general, make sure that when you notice some of the symptoms that Dr. Mwaba did highlight earlier on, you quickly get the help from healthcare providers. It could be at the clinic or possibly at a hospital, and of course make sure that professional care is given to your child. Just now we go for our short break. When we come back, we want to look at our inbox as well and get to see, I could see a good number of messages are coming in there. People asking about, why does it pain when, some children are urinating? Others are asking about, yellow discharge. Could it be linked to urinary tract infection, and so on and so forth? So those are some of the issues that obviously Dr. Mwaba should be able to attend to immediately as we get back. Keep those messages coming, and of course we'll be attending to them shortly.
Meet the Bundas. The Bundas are a typical modern family, and just like you, they always need to be connected. You see, Mr. Bunda needs rock-solid internet to share files with the office. But with his home broadband, syncing can take hours, and video conference calls, forget it. Charmer just wants to download his favorite show, but he may grow old before that happens. And Gran, she just wants to get to level 20. Their home connection is useless when everyone's online. And when the weather turns bad or the power goes off, the Bundas are left disconnected. High Fibronics brings the best fiber internet to your home. Unlike outdated ADSL, which shares your old unreliable copper phone line, High Fibronics uses a dedicated high-speed fiber cable. This runs underground straight to your home, making it resistant to lightning and weather. If fiber's already available in your area, we'll connect you within days and with minimal disruption. High Fibronics is capable of speeds up to 100 megabits per second to and from your home, with room to upgrade in the future. Forget buffering, interruptions and delays. Get awesome, uninterrupted service all the time, letting you do what you want online, when you want. You deserve to live like this. Go to www.highalive.co.zm or call 255 037.
Kings are born and not chosen. In one kingdom, the first generation, where people are happy with a lot to celebrate about. But when the first chief in Sofwa dies, it's the playful grandchild who takes over, Chief Muzo, and the palace is turned into a common house. Chief Muzo rules.
I am the king.
There is drama.
You are going to marry these 3 women.
If he was here, I could have stabbed him to death.
All right, so welcome back, ladies and gentlemen. Remember, the number is on your screen. Keep those questions coming. Dr. Mawa will be attending to them shortly. All right, now, before we even get to the text messages, when you realize that, or when you suspect that a child has got urinary tract infections, what are some of the investigations that you usually conduct?
Okay, so again, it depends on how sick the child is. So the basic investigation will the urine culture to try and figure out, is it really a urinary tract infection? And then for those children who may be very ill, we would do a full blood count and perhaps check how the kidneys are working. And then once we've proven that this patient has a urinary tract infection, by getting a positive culture, all such children would have some imaging. And for us, that would be an ultrasound of the kidneys, the ureters and the bladder. And the reason we do that is to make sure that this child does not have all those things that we talked about as potential risks for urinary tract infection. So we want to make sure the patient doesn't have stones in the urinary tract that are blocking the flow of urine. We want to make sure they have no congenital abnormalities of the urinary tract that cause stasis of urine in the urinary tract. So basically, those would be our investigations.
Okay. Any complications that may arise as a result of the UTIs?
Yes, there are a number. The first is an acute complication. As you know, urinary tract infection is an infection. So if it's not properly treated, well controlled, it may then disseminate and spread and cause septicemia. And this is particularly a risk in children who may be immunocompromised and in children who are less than 2 years old. So those then would become very, very ill and could actually die from urinary tract infection. But long term, as I had mentioned earlier, urinary tract infections can cause scarring in the kidneys. The same way that when you hurt yourself on the skin, you can heal with a scar. The same thing happens on the inside. And so you get a situation where, particularly in children who are getting recurrent urinary tract infections, they get scars in the kidneys. And when they get scarred kidneys, that becomes a risk for them going into renal failure eventually as adults. And then apart from that, the renal scarring also puts them at risk of having hypertension as adults. And renal scarring has also been associated with pregnancy-induced hypertension later on in life. So for those reasons, then it becomes important that health workers pick up as many UTIs as possible and that we appropriately investigate these children and treat appropriately.
Talking of treatment, how is treatment conducted?
Okay, so when we talk about treatment, again, it depends on the classification that we give the patient. So patients with lower urinary tract infections, that's infection of the bladder or cystitis, that's a minor infection. So because of that, we would probably treat with an oral antibiotic for 7 days, 5 to 7 days, but really I prefer 7 days. But for those patients that have features of an upper urinary tract infection, so they have fever, they have vomiting, we would prefer to give intravenous antibiotics for at least 7 days. And then for children, remember I said that for pre-verbal children, particularly those below the age of 2 years, they can't verbalize, They won't tell you there's just burning, I don't have flank pain. So we sort of err on the side of safety and would then treat those children with intravenous antibiotics as well.
So these urinary tract infections, the UTI in short,
Yes.
when a child has been, treated, are there any chances that they may reoccur again?
Yes, there were some studies that were carried out in Europe, and they found that for every child who had a urinary tract infection, about 30% of them would go on to get a recurrent urinary tract infection. So a small percentage of those children would get what we call a urinary tract infection. That's more likely to occur if the child has an abnormality of the urinary tract, or if they have a problem with the way that the bladder functions, or if a child has chronic constipation. Those are some of the things that would then be risks for recurrent urinary tract infections.
Getting to the text messages, we begin with M from obviously Luansha. What if the child is urinating yellow color? As you answer that, I think maybe you can as well respond to others who are asking about this yellow color thing.
Okay.
What is the normal color of urine?
Okay.
And when should a parent really get, curious and
Okay.
suspicious?
Right. So that yellow color of urine is probably normal. It just it's a result of pigments that the body is getting rid of through the urine. So the intensity of that color of the pigment depends on how concentrated the urine is. So for example, now it's really hot. Temperatures are in the 36, 37 degrees Celsius range. People are probably dehydrated, and so you would then notice that children would pass, more yellow urine, but it's normal. It just has to do with how concentrated the urine is.
So definitely parents should not be concerned.
Not with yellow urine, no.
So when should parents get concerned?
Well, I would be concerned if a child is passing red urine, which would be suggestive of bleeding.
Mm-hmm. I think there was one text actually where, there was a question on what if a child is urinating blood.
Okay, so if a child is urinating blood, certainly we would be concerned. And some of the things in our environment that would cause that would be things like bilharzia, so schistosomiasis infection. So these would often be boys who are pre-adolescents. They've been a little naughty. When mom wasn't looking, they've gone off to swim in a dam, in a river, so they've gotten infected with schistosomiasis. And typically when they pee, you find that the urine will be clear, but towards the end, the urine then would be blood-stained. So that's typical of schistosomiasis. Other causes of red urine in children would be, for example, if they maybe have stones, and then there are certain diseases that they affect the kidneys. We call them glomerulonephritis. Those may also cause red urine. And then other than that, drugs can also change the color of the urine. For example, patients who are on a TB drug known as Rifina or rifampicin may actually find that the urine will be a little orange. So the key thing is that if a child is passing blood in urine, that child should be taken to your nearest health center so that then we can evaluate them and see whether it's something that we ought to be worried about or not.
Good afternoon, doctor. My daughter was diagnosed with nephrotic syndrome. Is it part of UTI? What other treatment can I give apart from erythromycin? Okay,
so nephrotic syndrome is not an infection. Nephrotic syndrome is something totally different. Nephrotic syndrome happens because there's an abnormality at the level of the kidneys. So everybody's kidneys has a sieve, and that sieve prevents protein from coming into the urine. So when there's a problem with that sieve, we begin to see protein in the urine, and the patients begin to swell. So it's a totally different condition, and we do not use erythromycin, which is an antibiotic, to treat nephrotic syndrome. And so I would urge that mother to go to her nearest health center and have the child properly assessed because the treatment then for nephrotic syndrome would be something totally different.
Good afternoon, doctor. Is tonsillitis in any way connected with UTI, MUM-X?
Okay. No, tonsillitis is not in any way connected with urinary tract infections. So tonsillitis would be an infection of the tonsils, the upper respiratory tract there, in that region. So a totally different area.
Okay, interesting. Exactly. So now, when a child is on treatment, what is expected from the mother? How is the child supposed to be cared for, and how long is the treatment?
As I said, treatment would be with antibiotics. If it's not a severe case, we would use oral antibiotics. For severe cases, we would probably admit the child and give intravenous antibiotics. But there are other things that can be given to sort of reduce the burning sensation when the patient is passing urine. We can give citrus soda to make the urine a little bit more alkaline and make it a little bit more comfortable for the patient to pass urine. And then we would generally encourage mum to give as much fluid as possible, and that helps to flush out the bacteria. So the more urine the patient passes, the more they'll clear the bacteria. Yeah.
In extreme conditions, in extreme conditions where a child possibly is struggling to urinate or anything like that, here in Zambia, have we? Do we have it in record where possibly, UTIs have led to loss of lives in terms of children?
Well, I wouldn't say we have it on record, but we've seen children with neglected urinary tract infections who have died. Because remember, I said that especially for pre-verbal children, and in this case I'm thinking particularly of the age group less than 6 months, those children can't speak, and so by the time you're seeing them, all you know is that they have fever, they have sepsis. So in actual fact, they may have a severe urinary tract infection, and if that is not appropriately treated, some children have ended up dying.
Interesting.
And then you had also mentioned the fact that urinary tract infection and not passing urine. One of the commonest causes that I've come across here in Zambia of, children presenting to us with a urinary tract infection is an abnormality which involves the outlet of the bladder, known as posterior urethral valves. So at least that's something that parents can watch out for. So if your little boy it occurs in boys. So if the little boy doesn't have a strong urine stream, so that instead of the curved urine stream, the urine tends to fall to the ground. If the boy has to push to pass urine, those may be signs that your child has a bladder outlet obstruction. And then that kind of a child needs to be seen as quickly as possible by healthcare workers so that they can be assessed. And if we assess them, we can maybe prevent them from coming in extremis with a severe urinary tract infection.
As we conclude for today, how can we prevent UTIs? Obviously, especially for mothers, fathers who have got little kids, and of course, how can we prevent these infections?
Well, in terms of prevention would be the controllable factors, trying to remove those would be, in girls, it's been shown that giving them bubble baths may predispose them to urinary tract infection, and also hygiene. As I mentioned earlier, for girls, teaching them to wipe from front to back rather than back to front. Those would be able to prevent urinary tract infections, but also in addition, making sure that we treat constipation, because constipation is one of the commonest things that would predispose children to urinary tract infection. And then also of note is that for boys, studies have been done which show that being circumcised has a protective effect against urinary tract infections. So those are some of the things that have been shown to prevent chances of children getting urinary tract infections.
Interesting. Mom X is actually back. Exactly, and you remember she had asked about tonsillitis, if it's linked to UTIs.
Yes.
Now she's back here. She says, I noticed my son was swollen in the groin area when he was diagnosed with tonsillitis, and he complained of pain during urination. What could have caused that?
Well, it's difficult for me to make a diagnosis just based on that. I would have liked to see the type of swelling exactly that was going on. But then the other explanation might be that sometimes it depends on how that diagnosis of tonsillitis was made. So often you get a situation where you have a patient who has fever and nobody seems to know why they have fever. So then you look at their throat, the throat looks a little red. That's not a definitive diagnosis of, tonsillitis. So maybe in actual fact, at the time that that diagnosis was made, this child could have had a urinary tract infection. So the best thing to have done at that time would have been to collect urine from that boy and send it to the lab for culture to determine whether or not he had a urinary tract infection. There are other things that can cause swelling in a boy like that. So it would be interesting, if that recurs, to actually have a look and see exactly what's causing the swelling. Because typically, urinary tract infections would not be expected to cause swelling for boys.
Is there a connection to urinary infection when a child's testicles starts shrinking?
No, there's no obvious connection.
All right. I think the rest, some of the messages here coming, they are asking on the pain when urinating, the pain when urinating. I've had a couple of, this question coming, and it keeps on bouncing back,
Yes.
from somebody in Kabwe, somebody in Kasama, somebody in Southern Province.
Yes.
They keep on asking about pain when urinating, pain when
Yes.
urinating. So now, maybe for the sake of these, is it natural to experience some sort of pain when you are urinating?
No, it's not natural. Pain is a sign from our bodies that something is not right, and that we probably ought to visit a healthcare worker to try and figure out what's causing the pain. So in the context of what we're talking about today, which is urinary tract infection, one would expect to hear from a patient who has a urinary tract infection that they have this burning sensation, they have pain when they initiate, when they try and pass urine. But there are other things that can cause pain. For example, if a patient has stones and then they're trying to pass a stone, that could also cause pain. It's not so much in children, but maybe in adults, there are infections associated with the urethra that could also be associated with pain. So no, pain is not normal, and it's just a sign that one needs to visit one's doctor, try and figure out why they have pain.
Well, Dr. Mova, thank you so much.
Thank you for
Thank
having
you so
me.
much for coming through to share with us on this particular topic of very, very importance. I'm sure that the message is louder and clear. Hopefully that your office will be accommodative even next time when we call on you to come and just help us on one or two things here.
Okay, thank you, Nelson.
Thank you so much. All right, so ladies and gentlemen, that's it for today. I think it's been a great discussion that we had. We're discussing urinary tract infection, and of course, quite a lot has been highlighted. Quite a lot of questions as well from the general public, and of course, hopefully that you've received your help. But if you've got further questions, please feel free to visit your nearest health center, and you're going to find qualified pediatricians there who will be able to assess and attend to you. And to everybody who's having, these questions on, the color of urine, reddish urine, discharge, and so on and so forth, please make sure that you go and get a one-on-one discussion with any healthcare provider at your nearest hospital, and they should be able to respond to most of these questions that you have. Something that I've discovered is that most of us really have kept some of these problems for a long time, and we have been so afraid of visiting, healthcare providers, healthcare hospitals, and so on and so forth. It's important that we see these people as our friends, and people who are there just to help us. And remember, these people are bound by their ethics. So whatever you disclose to them, they respect confidentiality. So you should know that by now. So whatever you're going to discuss with pediatricians, doctors, nurses, will not walk out of that particular room. It will definitely be confidential. It will be between you and your healthcare provider. So you have every reason to disclose anything to these people, and they will be of help. Thank you so much for your participation. Make sure that you join us next week, as we will be discussing another infection, another disease that is so common as well in our children. Today we tackled urinary infections, but we have diarrhea coming, we have malaria coming, and of course others as well. These are very common problems that most of our children really get to get sick of. So make sure that every Sundays between 13 and 14 you join us for such discussions. I've been your host, Nelson Zulu. Until then, it's bye-bye and God bless.